Hi, I'm Angela Bass, Executive Director of the Mississippi Early Learning Alliance, which we call MELA. At MELA, we work to achieve systemic change leading to the holistic development of Mississippi children in their first 8 years of life. And we do this by providing backbone support to a diverse group of stakeholders working towards a shared goal. In short, we help people work together. Currently, our goal is this: by 2030, Mississippi's childcare system will be state-of-the-art, fueled by robust data, resources, and cross-sector collaboration to meet the needs of all children and families. It's a big goal, but I know that we can get there. And to that end, the Mississippi Early Learning Alliance, MELA, is working to understand what it could look like for Mississippi to have a state-of-the-art childcare system and what it will take to get there. We're working to elevate the voices and perspectives of the people at the center of this system, our childcare providers.
Well, being a childcare director for 24 years, you get to see a lot of different things in early childhood. You get to experience a lot of different people. And so us going through this process of the pandemic has brought change in a lot of childcare centers. It has reduced staff because the people are fearful and not wanting to come to work to catch this nasty disease. The parents are in need, and we are essential workers. So the idea came from one morning just saying, how can I help? How can I help other childcare centers be able to sustain staff? And the idea popped in my head early at 4 a.m. one morning, an early childhood job fair. Getting together with other directors that have the same vision, that have even the same issues, and bringing them into one platform together so that we can attack this job employment situation in the state of Mississippi on one accord. We designed this organization called Teachers Care For, CARE standing for Child Care Assurance with Recommended Educators. So it's designed to be able to get involved with child care centers and help them to find quality staff. And after finding those quality staff, help them to get those staff trained so that they can matriculate in their classrooms. They can be able to understand what it means to have compassion and have love for the children and the job that they do. Not to just show up to work every day for a paycheck, but show up to work because they really care about what they're wanting to do, and they really care about teaching children and being able to see them grow from birth all the way up to pre-K 4.
We also had an opportunity to visit the northern part of the state in Olive Branch, Mississippi, with Pastor Lee, who runs Little Saints Academy.
My early childhood education center was at my grandmother's house. That's who was responsible when my mom would work for keeping and nurturing us. And I feel like what happens a lot, especially in our community, is that we get that nurturing, we get that love at an early age, but we don't necessarily get the other piece, which is the education component that goes along with it.
Being in early childhood, I knew that the foundation of what children learned was very important. And as a child care provider, we have an opportunity to give them so much at an early age that parents, for lack of better words, not that they don't have the time to do it, they're busy. So they may not have time to teach etiquette all day long. They may not have time to teach social and emotional skills. Something as simple as cover your mouth, say please, say thank you. Little things. Preschool etiquette, I think, is overlooked. If we could teach them at 2 and 3 how to say excuse me, how to say thank you, how to say please, how to cover their mouth, how to wash their hands, by the time they get to kindergarten, it's a breeze. All they want to do is learn. They've already learned the basics.
I don't really like using the term school age, because I think school age starts when a child enters our doors. And if that's 6 weeks, I think it starts then. From the time that they are born, I think active learning starts then.
It's very hard when being a business owner and you feel like the early childhood arena is not respected. And we're trying to bring a bigger light to say, hey, we're not daycare centers. We're early learning institutions that are designed to bring together children, parents on one accord, be able to adhere to, the growth process of what children need.
We tend to act as if education doesn't start until pre-K 5. And that troubles me tremendously. I think that there has to be a greater connect between the early childhood education community, the local school districts in which they are in, and then the state. But I don't understand why we have pre-K 5. The Department of Education pick up pre-K 5, and then we're with the state health department. But we are an institution of education. And I think it's that disconnect, because of that disconnect, that there's also a disconnect in the importance of funding early childhood education. One child, average tuition for early childhood education, somewhere between $7,000 and $10,000 annually. That's a huge chunk of what a family brings in. So we try to be mindful of that and keep our tuition rates down, but they come at the expense of what we can do for our teachers. And so we're having to make tough choices about what we're going to do that's going to impact families, so that we can make sure that we are doing what we need to do for our most important asset, our teachers. That human resource asset, we gotta take care of them now. Because for years we've gone with that model, but it's been our teachers that have suffered the most. Because I actually checked to see what it would take for us to have some type of investment at the state level for retirement for our team. And it's astronomical. It's astronomical. And so you're going to tell them to take an already small paycheck and think about the future with that when they are really trying to get through the right now. And so that piece troubles me, because I think it's the disconnect that's also causing the disproportion in the way that early childhood education educators are treated from the state level, in the way that they're handled. So it bothers me deeply.
So you touched a little bit on this, but I'm gonna ask you just directly how you and your staff and your team here at Little Saints Academy define quality, and how you strive for your own definition of quality.
When we start to think about quality, the state will outline some of the things that they feel express quality, but those things have been a little bit of a moving target with some of the changes that have gone on with different initiatives, so forth and so on. So for us, we just tried to keep in mind who we wanted to be as educators and what education looked like for us. So when we start talking about quality, one, we want to make sure that we're bringing in the right people for the team. Teachers that are passionate, teachers that want to grow, teachers that don't mind being challenged to step outside of their comfort zone. I like innovators, and then I like people that bring solutions and not problems. So I like teachers that see something that needs to happen in the classroom and they make it happen.
Quality consists of great staff, great communication with parents. Quality consists of great classrooms that are set up for early childhood learning with all of your learning centers. Quality also consists of being able to support those families that have children with disabilities and being able to collaborate with other people, different resources, different child care advocates, and just standing for what it takes to educate the entire child, not just parts of the child, but the whole child. And quality in those centers are just those different aspects where the director or that owner, along with her staff, bring those different parts together to be able to sustain and be able to make sure that children are growing at the level that they need to grow.
We know that one of the big wins in our state is the implementation of the Early Learning Collaborative, which meets 10 of 10 national benchmarks for children. Whenever child care providers can join these collaborations, it's a win for our kids. We were able to travel to Hattiesburg and learn about how Hattiesburg Collaborative was incorporating child care centers in their collaboration.
And a lot of times child care centers are overlooked because they are private organizations, but a lot of our students do come through child care centers. So just being able to provide that quality education for those teachers, for those students, the professional development will help the school district in the long run. We do a lot of work with the child care centers through our early childhood center, where they are able to come in and be a part of all the benefits that we have, full-time computer lab, literacy events, all those things. But the great component of it is now we have a great role in what the child care centers are doing, the professional development that they're getting. So it's a great investment for school district because you're starting early, you're reaching those students early, and the learning will continue through the collaborative because you're already knowing what those students are doing, and the kindergarten readiness is just a part of what we're doing to create lifelong learners. The students get a chance to experience literacy early. They're introduced to the print, the rich print environment that the child care centers provide, being able to explore the different options that they have in their centers, whether it's, again, from the rich environment or just being able to collaborate with other students and being able to see fluent reading, fluency with number of facts or any of those components that go into it. So when they do transition to public schools and kindergartens, they're already ahead of their peers who did not have that foundation.
Well, the awesome part about being a part of the collaborative is the collaboration. Hattiesburg Public Schools have a set curriculum, and we're able to gain professional insight. What they are able to do for us is we're able to have professional coaching from collaborating with other professionals and just bouncing information off of one another to see what works and what doesn't work. Because just having this collaborative and it introducing innovative learning into my center is all worth any challenge that we may face.
What are some system-wide things you think could be implemented that could mitigate some of the issues that are happening in your centers?
So from any agency, whether it's the health department, the Mississippi Department of Human Service, the best way that they can aid us in early childhood is just open transparency and open communication about anything that's coming down the line. Our focus is to train the children. That's what we're focused on every day, is making sure that those children learn what they need to learn, they're growing how they need to grow. If there are any problems that they're having, that we're able to reach out to different resources to bring in physical therapists, occupational therapists, and being able to network and partner with the Department of Human Services, with the health department to help us, aid us in those processes, makes us greater makes what we're doing every day better, makes what we have to do every morning a little easier. And so being able to pick up that telephone and have that one-on-one conversation to say, hey, this is what I need. How can you help? How can you provide trainings for our staff? How could you come in and provide financial support for our schools so that we can continue to do what we need to do for the children? I always tell parents that my job is to make sure that your children have an easy transition from early childhood to public school when it's time for them to progress. And we all know that if they have a great foundation, if they start well, those are the students that end up in the Ivy League universities. Those are the students that become the politicians and the historians of our nation and even the presidents of our nation. It all starts with us.
So when we educate our young people, Dr. Bass, we're changing the numbers. And that's big to me. Teenage pregnancy is going down. The dropout rate is going down. Incarceration rates are going down because of what we are doing here. And so we're not only impacting the lives of each family and each child, we're impacting the community as a whole. So we have to invest. And so for me, when I'm looking at what we're doing, we're educating the next generation. We're ministering to families. We're allowing a mother and father to go to work each day with confidence that their child is in a great place and they are learning. And you can't put a price on that.
We hope that you've learned a lot about the early childhood system from the perspective of childcare providers in our state. We invite you to join us as we build a state-of-the-art system for our children. For more information, please go to msearlylearning.org.